Bronchiolitis obliterans organizing pneumonia, abbreviated as BOOP, is a specific way in which the lungs may respond to an inflammatory stimulus. Its diagnosis is usually histological, as its histology reveals the changes of a pneumonitis with organization of inflammatory cells into the granulation tissue. The disease originates in the alveoli with a variable amount of extension into the airways. Now notice here that in addition to the alveolar inflammatory changes found with regular pneumonia, there is also the involvement of bronchioles. Histologically, it is characterized by mild, chronic, patchy interstitial inflammation without fibrosis, and the presence of buds of granulation tissue made of mononuclear cells, foamy macrophages, and fibrous tissue, which is termed as Mason bodies. Mason bodies are rounded balls of myxomatous, that is the bluish tingish connective tissue that form the intraluminal polyps within the bronchioles and the air spaces in the distal airways, which may cause secondary bronchiolar occlusion due to extension of the inflammatory process. Hence the reason for being previously termed bronchiolitis obliterans organizing pneumonia, termed as BOOP. Because of the lack of the pathognomonic signs and symptoms, diagnosis is often delayed. Symptoms of BOOP may vary from person to person depending upon the specific type. Let's have a look at the clinical features. For example, people with idiopathic BOOP have a flu-like illness, while people with BOOP associated with an underlying connective tissue disorder have cough or shortness of breath. Some individuals with BOOP, such as focal BOOP, may have no apparent symptoms. Focal BOOP is a type of BOOP which is difficult to be distinguished from lung cancer and shows multiple bilateral nodular lesions on a radiological examination. On the other hand, acute, rapidly progressive form of BOOP exists that can progress from symptom onset to acute respiratory failure in only a few days and can even prove to be fatal for these individuals. This form of BOOP may be associated with an underlying fibrotic process. Irrespective of the type of BOOP, some affected individuals develop a general feeling of ill health characterized by malaise and weight loss. Individuals with BOOP may develop small crackling or rattling sounds in the lung, which are basically termed as crackles or rales on auscultation, that are apparent only upon physical examination. In rare cases, affected individuals may experience chest pain, joint pain characterized as arthralgias, night sweats, or coughing up blood, which is termed as hemoptysis.